Today we will be discussing which were asked in MUHS Winter 2018 Oral and Maxillofacial Survey. So we'll go to the first question. The first question is the chisel should be used with the options are A. Bevel towards the bone which is to be saved. B. Bevel towards the bone which is to be sacrificed. Option C. Bevel towards the is not important. Option D. Flat surface parallel to the direction of grades. And answer is B. Bevel towards the bone which is to be sacrificed. The second question is most common site for dry socket. The A. Lower incisor area. B. Upper incisor area. C. Lower molar area. D. Upper molar area. And the answer is lower molar area. As there is cortical bone present which have less blood supply and food accumulation is also more there. The question third, extraction of deciduous teeth in dental clinic can be carried out in which stage of anesthesia? A, stage 1, B, stage 2, C, stage 3, plan 2, D, stage 3, plan 3. And answer is A, stage 1. Question 4. Role of sodium metabisulfide in local anesthetic agent is A. Preservative, B. Fungicide, C. Reducing agent, D. Vasoconstrictor. And the answer is C. Reducing agent. Question 5. A palatal flap has high success rate in oral anal fistula because of A. Abundance of blood supply to the tissue. B. Branch of palatal artery is removed. C. It is resistant to infection. And D. Of fatty tissue layer there are less chances of tear. And the answer is A. Abundance of blood supply to the tissue. Question 6. Infection from maxillary first molar spread most often to which space? A. Infratemporal, B. Retropharyngeal, C. Submandibular, and D. Buccal. Infratemporal and retropharyngeal are secondarily infected spaces, and submandibular and buccal space they are primary spaces. But buccal space is nearer to the maxillary first molar, hence it will most oftenly get infected. So answer is D, buccal. Question 7. Following structure of ethmoid, CSF rhinorrhea will increase in all of the following conditions except A. If patient sits up with head inclined forward, coughing or straining. C. On lying down. D. On applying pressure over jugular vein. And the answer is C. On lying down. Question 8. All of the following muscles may cause displacement of fracture segments in mandibular except A. Medial pterygoid, B. Lateral pterygoid, C. Masseter, D. Caninus. And answer is D. Caninus. Question 9. In a vertical favorable mandible angle, the fracture line passes A. Posterolateral point to anteromedial point, B. Anterolateral point to posteromedial point, C. Forward towards the alveolar ridge from posterior point on anterior border, D. Backwards towards the alveoli from anterior point on inferior border. The answer is anterolateral point to posterolateral point. As we can see in the diagram, this will resist the movements which is caused by the medial pterygoid muscle. Question 10th. Type of shocks commonly seen in trauma patient is A. Cardiogenic, B. Hypovolumic, C. Endotoxic, D. Neurotoxic. And answer is hypovolumic patient. During trauma, due to loss of blood, hypovolumic shock is more likely to occur. Question 11. Which graft has greatest osteogenic potential? A. Autogenous cortical bone graft. B. Autogenous cancellous bone graft. C. Homogeneous bone graft. And D. Freeze-dried bone graft. Option C and D. Homologous bone graft and freeze-dried bone graft are the examples of alloplastic bone graft, while A and B are autogenous bone graft. But in cortical bone, there are less osteoblasts present, and cancellous both there are more osteoblasts present. Hence, the correct answer is B. Autogenous cancellous bone graft, which have more osteoblasts and have greatest osteointegration, osteogenic potential. 12. Scrub technique refers to A. Cleaning operating room. B. Washing of arms and hands before gloving. C. Washing instruments. And D. All of the above. This is straightforward question and answer is B. Washing of arms and hands before gloving. 13. The goal of pre-surgical orthodontics is are A. To relieve arch crowding. B. To eliminate ground dental interference. C. Eliminate tooth discrepancy. D. All of the above. And the answer is all of the above. 14th. Point of choice for dentures cyst in the crown of an unerupted molar in 15-year-old patient is A. Observation only, no treatment. B. Expose the crown surgically and keep it exposed. C. Extract the tooth and inoculate the cyst. D. Aspirate the content of the cyst. And answer is B. Expose the crown surgically and keep it exposed. This will allow the tooth to erupt in the oral cavity and to its functional position. 15. All of the following are advantages of cryotherapy except A. Procedure can be done without local anesthesia. B. Provides ample of tissue for histopathological examination. C. Desquamatation is comparatively not painful. D. Usually absence of infection and scarring. And the answer is B. Provides ample of tissue for histopathological examination. Question 16. Axonotmesis is defined as A. Mild temporary injury, compression of nerve. B. Disruption of loss of continuity of some neurons, but general structure of nerve remain intact. C. Complete severance of all layers of nerve. D. None of the above. And answer is B. Disruption of and loss of continuity of some neurons, but general structure of the nerve remain intact. In axonotmesis, there is disruption of the axon, but the myelin sheath remains intact. 17. Hyperbolic oxygen is used in treatment of A. Osteoradionecrosis, B. Syncope, C. Respiratory obstruction, D. Cardiac arrest. And the answer is A. Osteoradionecrosis. Question 18. Sensitivity to local anesthetic is greater in options are A. Type B fibers, B. Type C fibers, C. Type A delta fibers, D. Fibers supplying the muscle spindles. And the answer is A. Type B fibers. 19. In Gillis temporal approach, forceps zygomatic fracture, uh, arch fracture, Rowe's disinfection forceps is placed between A. Superficial fascia and temporal fascia. B. Between temporal bone and temporalis muscle. C. Between temporalis fascia and temporalis muscle. D. Skin superficial fascia. And answer is C. Between temporalis fascia and temporalis muscle. 20th. Odontogenic infection are most caused by A. Mixed bacteria, B. Anaerobic bacteria, C. Aerobic bacteria, and D. Streptococci bacteria. And the answer is A. Mixed bacteria. All the infection in odontogenic infection mostly caused by mixed bacteria, almost 60%. Anaerobic bacteria causes 35% of the infection. Aerobic bacteria causes 5% of the infection. In all the aerobic bacteria, streptococci causes 90% of the infection. Thank you.